doing some excellent work over at MedStar. You know, October, Breast Cancer Awareness Month, and it's the most common cancer associated with women, but it is not the only one. Dr. Ziv Gamliel joining us now. He's the Chief of Thoracic Surgery at the Angelos Center for Lung Disease at MedStar Franklin Square Medical Center. You're making a house call with us tonight. Let's talk about lung cancer. Do women have the same risk as men for lung cancer?
Historically, women haven't had the same smoking rates as men, and so they have had less lung cancer than men, but they pretty much almost caught up. As it turns out, though, women are more susceptible as a whole to the same level of cigarette smoking as compared with men. So if women smoke the same amount as men, they are more likely to contract lung cancer.
So obviously smoking is a risk, but are there other risks to lung cancer as well?
There are other risks. Smoking far and away is the most likely contributing factor to developing lung cancer, but in addition to bad luck, there's also exposures to other things like asbestos or radon gas. I think that of preventable causes, smoking is the most important cause of lung cancer to take into account.
And what about vaping?
We don't have as much information on vaping as we do on cigarette smoking. It's a relatively newer phenomenon, but as it turns out, many of the carcinogens that are found in cigarette smoke are also found in vape, and so it doesn't really do you any good to inhale those.
You know, you have these rare cases when someone is diagnosed with lung cancer, somebody who is not a smoker at all. How is lung cancer diagnosed?
Sometimes lung cancer is picked up because a patient has symptoms. Often when that's the case, it's too late to cure it. The best way to pick up a lung cancer is by screening individuals who are at risk. So if you are somebody who is a smoker or who has been a smoker in the last 15 years and you're between the ages of 50 and 80 and you've smoked a pack a day for 20 years or more, you should get yourself screened.
Okay. No hereditary, nothing like that as far as lung cancer is concerned?
There are some families that have a higher than expected rate of lung cancer in them. It's really a poorly understood phenomenon, and thank goodness it doesn't seem to be a very common issue.
All right, Dr. Gamliel, thank you very much for joining us. We got our folks in the studio still waiting for your calls. We're going to be on for about 10 more minutes, so give them a call. The number right there is on your screen to get your questions answered.